Hello and welcome. I'm Lisa Almo, Community Relations Representative here at the Lakeshore. Before we start our presentation today, I would like to share a little bit about our beautiful community. Many of you have visited here before, but some of you might be new to the Lakeshore. So I would like to share with you that we are a premier retirement community that sits on the south shore of beautiful Lake Washington. We have 156 senior apartment homes, offering a variety of studio, 1-bedroom, and 2-bedroom floor plan options. Right now, we're moving residents into our community, and we are able to do full in-person community tours. So if you're interested in learning more about the community or coming for a tour, please feel free to contact Alicia, myself, or Lexi here in the Community Relations office. We'll be happy to assist you. I also want to make sure that you are aware of an extraordinary partnership that we have with the University of Washington School of Nursing, Pharmacy, and Social Work. And that relationship is how we are able to have wonderful speakers and presenters like Dr. Hirano that we have today helping us. So this is really very special for us. Our residents, they benefit from this partnership to deliver innovative programs designed with healthy living in mind. The partnerships lie with the University School of Pharmacy and Social Work and Nursing. It's over 30 years we've had these relationships. And it's very powerful for us with the University of Washington, top ranked school of nursing in the country. So before we get to the main event, I'd like to tell you a little bit about our presenter, Dr. Lianne Hirano. She is the Associate Medical Director of the Palliative Care Consultant Service at Harborview Medical Center and a University of Washington instructor for Gerontology and Geriatric Medicine in Seattle, Washington. Wow. So take it away, Dr. Hirano. Thank you so much for helping us with this.
Thank you so much for having me. Okay, I'm going to start sharing my screen. So give me a second to do that.
Okay.
Is that appearing, Lisa? Great, thank you. I just want to make sure it looks okay. Yeah. Okay, my heart always stops because my screen goes blank for a second. So technology, it's the new double-edged sword of being wonderful and accessible, but also a little bit of a problematic curse sometimes. Okay, so welcome everyone. Thank you so much for joining today. I am giving today's talk about curious about cannabis, what to know about weed. I work for the University of Washington. I'm mainly stationed at Harborview Medical Center, where I'm actually currently attending on the medicine ward service. So very excited to have a little break in my day to give this talk. I have no relevant disclosures. I am a academic medicine doctor and clinical assistant professor, so not a lot of anything to disclose there. What I'm hoping to kind of talk through today is a little bit of the history about cannabis and cannabis products. It actually has a very long history, particularly in the United States. I think it's important to always kind of get a little bit of background on that. And then a little bit of the pharmacology as well, because that helps us understand the certain whys and hows of cannabis. And then the evidence behind, what we can use cannabis products for. There is some evidence, but as you can imagine, there's still a lot of room for research there. And then I'll finish up with some recommendations. Please feel free to ask questions throughout, but I will try to leave some time at the end for questions as well. But I really very much want this to be a discussion, and this is a talk that hopefully will generate some good questions and discussion as well. Okay, so as I mentioned, I always like to kind of revisit a little bit of the history of cannabis products. And the oldest known use of cannabis, if we're going way, way, way back, is debatable, but National Geographic says that it was found in Neolithic fire pits as long ago as 4,000 to 5,000 BC or BCE. And other sources say a Chinese emperor in 2727 BC was maybe around the first known use. It was introduced to Western medicine by a surgeon, Dr. W.B. O'Shaughnessy, back in the 1840s. And it was while he was working for the British East India Trading Company. And this is according to Dr. Worf, who's a professor who studied the history of cannabis at the University of Kansas. And you can see some of the uses. So pain, anti-inflammatory, to help with muscle spasms, and interestingly enough, to help with seizures. So other things to know about it, it was used by, well, potentially are thought to have been used by the British and Portuguese actually to pacify slaves during the slave trade. So a little bit of further history there. And then marijuana and hashish extracts were one of the most commonly prescribed medicines in the US from about 1842 to 1890s. You can see it was added to the US pharmacopoeia around that time as well in 1850, and then removed in 1941. Okay, so again, a little bit more history. It was actually, the use of cannabis products was actually criminalized in several times throughout history in 1914, 1937, and 1951. And then the Schedule 1 designation, which Schedule 1 drug classification is a classification that's given by the US Drug Enforcement Administration to drugs with no currently accepted medical use and with a high potential for abuse. So you can see that again, there was the Schedule 1 designation in the 70s, 1970, but then as we all know, it started coming back into consideration for medical use, as well as now recreational use. And so in 1996, California actually becomes the first state to re-legalize its use for patients with AIDS, cancer, and other serious illness. And then in 2012, if you'll recall, Washington and also Colorado passed the recreational use law I-502. And then again in 2015, Washington revisited this because the law got rather complicated because medical marijuana was legalized initially, and then they had to, and then recreational use was legalized, and they had to figure out how to merge the two systems because there were two systems of dispensary and then recreational use. So in 2015, the Washington Cannabis Patient Protection Act, or SB 5052, was passed as well. And then if you remember when the original I-502 bill was passed, I know many of you might recognize this gentleman who is a big proponent of legalizing cannabis, and that's Rick Steves. Okay. So which states is cannabis legal in? And it's legal in a number of states, but there are gradations of legality, right? So it is fully legalized for the states in black, and it is medical is legal, and cannabis overall is decriminalized in the darker green states. And then medical use is legal in the slightly lighter green states, and in the very light green states, cannabis is decriminalized. And then in the gray states, CBD, which we'll talk more about, we'll talk about the differences. CBD is legal only, not THC containing products. And then in orange states, it's fully illegal. And I actually looked at this map today, and this is up to date. The DISA.com is a really great place to find the most up-to-date map of legality for cannabis, and it's run by, it's a contractor with the Defense Department. So it's a pretty reputable, I would say, site to go to, and it has the updated laws by state as well. So it's a pretty good resource. Other things to note about legality, the bipartisan farm bill was signed by President Trump in December of 2018, and that legalized farmers in the US to grow hemp, which had previously been illegal. So hemp is the CBD containing product. And then a 2017 Gallup poll showed that 64% of Americans support legalization. So a little bit more than half the country, or a majority of the country, actually supports legalization of cannabis products, which kind of mirrors the map of the state that we see here, the states that we see here, right? And then countries that have legalized marijuana, you might remember that in 2019, our neighbors to the north legalized cannabis as an entire country, but they were actually the second country to legalize cannabis nationally. So a little bit of obscure trivia for those who like it. Uruguay was actually the first country to legalize marijuana or cannabis. So if you're interested in trying cannabis, you are not alone. About 2006 to 2013, the prevalence of folks who used cannabis in the past year was studied, and among adults aged 65 or older, they had a relative increase of A, 50%, B, 100%, C, 150%, or D, 200%, or E, 250%. And pick a number in your head that you think is reasonable. It's E, it's 250%. So a lot of older adults are turning to cannabis, and they're actually the largest increase in use is seen within the age group of 65 and older. Okay. So why is this? Why are people turning to cannabis? And if you're interested in trying cannabis, think about maybe the reasons that you would be interested in trying cannabis, because they're probably similar to the things that we're seeing in medicine. But a lot of aches and pains are actually very difficult to treat early, particularly with osteoarthritis. And despite osteoarthritis being around for probably as long as human history, we still don't have really effective means of treatment for osteoarthritis, which is really disappointing. And then other difficult to treat symptoms, right? So things like anxiety, insomnia is oftentimes very difficult to get control of, depression, post-traumatic stress disorder. And then if you're losing weight unintentionally, so weight loss, people think about turning to cannabis. It's, at least in Washington, it's over the counter and it's legal now. Maybe you've tried it before and had good success, or it felt fun and nice. It's natural, and therefore people think it must be safe. People think it's not addictive like opioids, so maybe feeling like you at least have an alternative when your doctor says, oh, your pain's really bad, maybe you should try some oxycodone. It might feel a little safer to try something that's safe and natural, and does not have the same addictive reputation. And then marketing, right? So this is a business, and it's actually a really big business, particularly here in Washington. And maybe you're just curious. Okay, so again, it's a business. There's a lot of direct to consumer marketing going on. And a lot of times it can be really fun to kind of check out a dispensary. They're filled with very helpful young people who have a lot of information for you on ways that cannabis might be able to help you. And a lot of folks are taking these field trips to directly to the dispensaries. So I'm going to switch gears a little. Oh, I'm going to pause. Did any questions come up in the chat? Not yet. Okay, I'm going to keep going then.
No, I haven't seen any yet.
Okay, great. I'm going to keep going. So just so that if you are thinking of trying cannabis and you visit a dispensary, or you're just interested in talking to your doctor or a pharmacist or to friends about cannabis, I'm going to give you a little bit of terminology so that we can all kind of be using the same language when we're talking about cannabis. So there are 3 different bioactive molecules in cannabis that have been identified, and the compounds are terpenes, flavonoids, and cannabinoids. So cannabis sativa, I forgot to mention, is the name. Cannabis sativa L is the name, the actual scientific name of the plant, right? Of the cannabis plant. And the compounds contained within it, the bioactive molecules I'm talking about that people think the effects are derived from are terpenes or terpenoids. So these are the aromatic chemicals that are found in plants. So when you think of the smell of pine trees, for example, or the smell of oranges, where a lot of essential oils come from, those are terpenes. And then flavonoids is the next one, and these are pretty common as well. And they're the components of things like green tea that are thought to have antioxidant effects, anti-inflammatory effects, so those health benefits that people think of when they think of things like green tea. And then phytocannabinoids or cannabinoids are the unique chemical structures that are found in the highest concentration of the female flower of the cannabis sativa plant. Okay, so when you go to, if you decide to visit a dispensary, you might hear them talking about something called the entourage effect. And this is the idea that combining these multiple constituents, the terpenes, the flavonoids, and the cannabinoids, which are contained in the natural plant, result in enhanced therapeutic effects. So the idea is if you just have the cannabinoids like the CBD or the THC by itself without the terpenes and the flavonoids, you don't get the same combined positive beneficial effects that you would get if you had the quote more natural product that combines all of these things, all 3 of the bioactive molecules, the terpenes, the flavonoids, and the cannabinoids. And why is this important, and why am I telling you this? It's because a lot of the pharmaceutical products that we have that are cannabis products usually only contain one thing, which is the cannabinoid itself, and that's either going to be CBD or THC. And we'll get into what those things are. And then if you go and visit a dispensary, the folks who are working there are called bud tenders. It's like bartenders, but bud tenders for cannabis. Okay. So the cannabinoids, what are they? There are more than 100 cannabinoids that have been isolated, but the important ones to know about are THC, so tetrahydrocannabinol. THC is the major psychoactive component in cannabis, and it's also the most studied, right? So this is the one that we think of when people get their high from using cannabis. It's the THC that we think is doing this. And again, it's thought of as the major psychoactive component. And then CBD, cannabidiol is the non-psychotropic constituent. So it's the one that we think of more as like acting on the body. So maybe producing the hunger that comes along with smoking weed, right? Or the slightly more mellowing effects, or that might maybe modulate things like nausea. Okay. It is also the product that we think of in hemp and hemp oil production. And hemp is oftentimes used for fiber products. I've seen it used in cord And again, that's what's now legal to be grown by US farmers. And for a long time, it was not legal to grow hemp. And hemp is distinguished from cannabis in that it has no really psychoactive components. Okay. Let's see if I mentioned everything I wanted to. Okay. Okay. So why do we get the effects that we get from cannabis? And it's partially because we actually have receptors for cannabis products naturally in our body. And part of the reason for that is because we have an endocannabinoid system where our body actually produces cannabinoids naturally. So the ones that have been identified are CB1 and CB2. Those are the two main cannabinoid receptors in our bodies that we know about. And you can see one was identified in 1988 and the other one was identified in 1993. And CB1 is located throughout the body, but it has the highest concentration in our central nervous system. So that kind of makes sense, right? Its activation results in kind of the classic marijuana effects that we think about, getting high. And then CB2 is the other receptor, and that's mainly in our immune system. So the highest concentration is actually in B lymphocytes. So these are the two known receptors, and then the two known endocannabinoids that our body produces naturally are anandamide and the 2-AG, which I'm not going to try to pronounce that right now. But these are interestingly expressed in high concentrations in breast milk. And they're thought to maybe have a role in that runner's high that runners who run regularly or long distance talk about. Okay. I should also mention that expressed in breast milk, CB1, actually, they've done studies where they've blocked this receptor in rats. And when they block the CB1 receptor, the rat pups actually will not feed and they actually fail to thrive and develop. So it has roles in our body. Okay. So I mentioned that I would go over the pharmacology because I think this is actually pretty important. If you're interested in oral or sublingual products, so products that you ingest by mouth, and these include any of the edibles that look like candies or tinctures or sprays, the time to effect varies. And it can be anywhere from half an hour to 4 hours. So the time that it takes for you to feel the effects of the cannabis product can be anywhere from half an hour to 4 hours before you feel anything. And part of that is because absorption changes with food. So it's increased with food. So if you're eating something, you've had a large meal and you take a tincture or an oral product, then the absorption gets increased and you might feel the effects faster, so closer maybe to the half an hour mark as opposed to the 4 hour mark. But this is where people kind of get in trouble because a lot of times the edibles come in like a cookie form and you're maybe supposed to eat like a bite of the cookie, and folks will take a bite and maybe they don't feel anything for the first half an hour, and then they eat the whole cookie. And then they show up in our emergency department with fast heart rate and feeling very terrible, and worried that they're having a heart attack. So it sometimes takes a long time before these products actually result in folks feeling any effect from them. So again, it's just important to keep in mind. And then if you're taking it with food, you might feel the effects faster. And then it lasts for quite a while. So you could feel the effects and continue to feel the effects for 6 to 8 hours, which is a good day. And then another route is inhaled. So that's kind of that classic smoking, or you might see people using bongs, right? So the vaporization, or even the e-cigarettes. And the time to effect there with inhalation is within minutes, so it's much faster. And then it lasts a few hours, so it's a shorter duration than the edibles, the oral. And then there are a lot of topical and transdermal products on the market. So things that you put on your skin, moisturizers, salves, you name it. but products that you apply to your skin. And we have not really studied very well the time that it takes to reach effect or the duration of those. So that's kind of a little unknown for us. And then anywhere that you can put things, you can use cannabis. And so there are suppositories available. And yeah, we really don't know the time to effect or duration in those cases either. Okay. So a little bit about the metabolism, because this will be important if you're thinking of trying it and you're on other medications. The metabolism for cannabis is extensively through your liver. So as you can imagine, many medications are also metabolized through your liver. And so that's very important to keep in mind if you're thinking of trying cannabis products and you're on other medications at the same time. And I'll give a little bit more detail about that. But you can see that it starts out as THC, it's metabolized in the liver to this more potent or psychoactive form of the THC, which can be 4 to 5 times more potent. So that's important to keep in mind too. It's excreted through stool. So rather than your kidneys working overtime to excrete it, it's excreted more through your gut. And actually, if you have kidney failure or kidney damage, the clearance for the cannabis product is minimally changed. So it can hopefully be still used with folks who have some kidney disease, okay, without too much trouble. Okay, so the drug interactions, like I mentioned, because it's metabolized through your liver, things like warfarin can really be, the effects of warfarin can really be increased. Things like Benadryl, which can cause a lot of sleepiness, some antidepressants, and then some other sleep aids can really, their effects can also be really increased. It's additive, so folks can have pretty significant sleepiness or somnolence or sedation. So being difficult to wake up, being really sleepy, and then things like benzodiazepines, so things like lorazepam, clonazepam, medications for anxiety are also increased. The effect is increased with cannabis products. And then of course, alcohol can also do that. CBD, which is the cannabidiol, that, because it's also metabolized through the liver, can actually increase levels of SSRIs, which are antidepressants, so things like Zoloft, and then antipsychotics, and then beta blockers, so things like metoprolol or Coreg, and then of course opioids as well. Okay. So some other issues with what we call, a natural product, right? It is a plant and it's a plant product. So the things that some folks worry about, they use certain herbicides and pesticides to make sure that that there aren't any insects or pests. And then the big one that I just want folks to be aware of is that mold or fungus, just like on any plant, like I have bad luck with tomatoes sometimes, but mold and fungus can grow on it. And then when you smoke it or inhale it, if you are immune compromised in any way, so if you have cancer or you have cancer and are undergoing chemotherapy, and you inhale cannabis products, I have seen folks present with terrible fungal infections in their lungs. So if you have any type of immune compromised state, or your immune system is just not as strong as it would be normally, I would definitely avoid smoking it, and consider other products instead, like a tincture or topical, or using it, like I said, orally or by mouth, as opposed to smoking it. Okay, and then product consistency. It's not regulated by the FDA, right? It's the honor system. So companies who produce these products have to quality control themselves if they do that. And then we don't. It's not a medication, so we don't know how much for a particular condition, although the bud tenders can definitely help recommend. Um, there's no there's no scientific evidence or basis behind using certain doses formally, medically, I should say, that we know of yet. And then there can be issues with like labeling and dosing. So the product might say it has so many milligrams of THC or CBD, but is that label actually accurate? And interestingly enough, JAMA did Vandry and colleagues did a study that was published in JAMA in 2015, and they looked at 75 products purchased, so 47 different brands, because there's a lot of products out there on the market, and 17% were accurately labeled. So really quite a low number. And then 23% were underlabeled and 60% were overlabeled with respect to the THC content. So that means that the majority of products were overlabeled. So that means that the labels were higher amounts than what was actually in the product. And so the greatest likelihood of actually obtaining underlabeled products, so those with more THC or CBD than labeled on the bottle, was actually in Los Angeles. And overlabeled products were in Seattle. So take that for what you will. Okay. So now to the good stuff. Does it work? What does it work for? And that's actually a surprisingly difficult question to answer. And I'll talk a little bit about why it's so hard to answer. But don't worry, I will get to the evidence that we actually do currently have. But I think it's actually important to kind of understand why it's so difficult to get good evidence on these products. There's a lot of barriers to cannabis research, even though a lot of it, people are attempting to do a lot of research in cannabis. It's been around for a long time, but because of its Schedule I label by the federal government, it is heavily restricted. And so, as you can imagine, trying to get grant money through federal agencies like the NIH, it's really hard because it's a Schedule I drug. So federally funded research is restricted to using this one strain of cannabis that's grown at the University of Mississippi, and it's the same strain that's been grown there for the past 50 years. And this is a strain that's available to researchers to use if they're interested in doing cannabis research with the actual plant product. As you can imagine, like any product, especially in places like Washington where it's legalized, there are many, many, many different strains, and there have been many, many advances in strains over the last 50 years. And so a lot of folks who engage in cannabis research feel like this product is actually kind of anachronistic, right? Like the product that the National Institute on Drug Abuse offers through the University of Mississippi is pretty weak compared to the strains that are out on the market now. And so they really feel like it's not the best product to use in research, but it's the only product that's available for folks to use in research. Otherwise, a lot of the research is then done by self-report of the types of products that people use, for which there's no standardization. So there's no standardization in dosage, product, or route in a lot of the self-reports because people are using many different things because many different products are available. So it relies heavily on self-report unless you're going to use this one strain. And there's a high risk of bias, right? Because we have oftentimes for things like osteoarthritis pain, we want something that works. So we're hoping that'll work. Or if you're a researcher who does not believe that it offers any benefit, there's bias there as well. And then blinding in research is a big thing to help with eliminating some of the bias. But can you really blind research in cannabis when it has such a distinct smell? I think people know pretty easily if they're getting the actual product or not. So folks have had to rely on a lot of pharmaceutical partnerships in order to engage in this research. Okay. So what has some of the research shown? So I will say that a lot of studies that bud tenders at the dispensaries will quote to you is research done in Israel. They are prospective studies using various roots and strains, oftentimes self-report, and these studies have had trouble blinding. So again, there's no blinding. These are not randomized control trials. And then the doses and routes are again not standardized because a lot of it relies on the self-reporting. But this is, I just pulled kind of a very typical or representative article about the effects of cannabis. And so a lot of these articles find that very positive results. And yeah, they're pretty common. Israel is producing a lot of this type of research. And again, you'll hear a lot of the bud tenders quoting these studies from Israel with the caveats and challenges that I mentioned. Okay. So a lot of our studies in the US rely on, like I said, partnerships with pharmaceutical companies. But again, keep in mind that I mentioned early on that a lot of folks feel in the industry, like the bud tenders will tell you that they think that the entourage effect is important. And our pharmaceutical products, as you can see, are really isolated cannabis products, so or cannabinoids. So some of these might sound familiar. Dronabinol, which is Marinol, is a synthetic THC product. And it is an oral medication. And the indications that have been approved for it are chemotherapy-related nausea and vomiting, appetite stimulation in AIDS patients, particularly because there is some evidence that in AIDS patients with wasting or cachexia, that might be helpful. And then the onset is about half an hour to an hour, and the duration is 4 to 6 hours. Nabilone or Sesamet is a synthetic cannabinoid receptor agonist, so it's a THC mimic. So it binds to those receptors I told you about, CB1 and CB2, and it's approved for chemotherapy-related nausea or vomiting. And you can see the onset and duration there. It lasts a little longer. Cannabidiol or Epidiolex is purified CBD. And this is purified from the cannabis plant itself, whereas these two others are synthetic. And then the root is an oral solution, and it's actually approved for refractory seizures in children. So Dravet's and Lennox-Gastaut syndrome are pediatric seizures. So seizures that occur in children, they're actually relatively rare, but it has been approved for that use. And then the nabiximols or Sativex, this is the one kind of mixture of THC and CBD. So it's a one-to-one mixture of THC and to CBD product. And it's an oral mucosal spray. And it's been approved for symptomatic relief of muscle spasms. So you can kind of see the relation here, muscle spasms and anti-seizure medication. So most studies that have been done in the US use one of these products, which are essentially, like I mentioned, purified cannabinoids. So there's no terpenes and there's no flavonoids. So it's essentially lacking in the other two bioactive compounds in cannabis. Okay. Any questions came up? That was a lot of information. Okay. I'm stunning you all into silence. So either this is very captivating or it's very boring. Okay, so here, let's get into some of the evidence that we have for various conditions. And chronic pain is a big one, right? So there have actually been over 30 randomized controlled trials for different types of pain with cannabis products. Again, most of these use the pharmaceutical products versus placebo. So there's no head-to-head trials. There's no trials of cannabis product like THC compared to oxycodone, for example, or THC compared to Tylenol, right? It's compared to a sugar pill. And what they found is that one of the studies showed a 30% reduction in pain symptoms, but interestingly enough, no benefit for cancer pain. And a significant proportion of folks did experience side effects and stop the treatment early. So the number needed to harm, which is how many people need to take the product or be exposed to the product in order for one person to have an adverse effect. So the number needed to harm in these studies range from 3 to 10. So if 3 people were taking the product, then that's how many would need to take it in order for one of those folks to have an adverse effect or a side effect, or 10 people taking the product and having one of them experience a not great effect. So that's actually a pretty high number for a number needed to harm. And again, none of these trials, unfortunately, were head-to-head trials. So I'll throw that out there. However, I want to also mention that states with legal cannabis report, so places like here, like Washington, report a modest reduction in the number of opioid prescriptions and opioid-associated deaths. So once they legalized cannabis, our number of opioid prescriptions and our number of opioid-associated deaths decreased. And I recognize that association is not causality, but that is something that people have studied as far as associations. Okay. How about for mental health and insomnia? So it's been studied in anxiety. And again, these are randomized controlled trials, but with the pharmaceutical products versus placebo. So versus a sugar pill, not versus something like lorazepam, or not versus something like an anti-anxiety medication. And what they found was that specifically THC, so the psychoactive cannabinoid preparations, may reduce symptoms of anxiety. And then depression and post-traumatic stress disorder, there's no good data, though it does not appear to worsen existing depression. And then finally for insomnia, so not being able to get to sleep, not being able to stay asleep, there is low quality evidence for a benefit in sleep disorders associated with chronic illness and in people with primary insomnia. So for folks who have no other causes of insomnia that's related to diseases, but with what we call primary insomnia, there may be some evidence for benefit. However, the side effects are similar to other sleep aids. So whether taking it or a sleep aid may have the same side effects. Okay. And then for other conditions, so things like appetite and weight gain, you would think that because it's portrayed in popular media that smoking marijuana really increases your appetite. So there have been a few randomized controlled trials where cannabis has been shown that it may increase your appetite and weight gain, again, in this HIV wasting syndrome, which is something pretty specific. So in folks with HIV, they tend to lose body fat and can have a lot of unintentional weight loss. And so it may improve appetite and weight gain in those folks. And unfortunately, there's no evidence that it helps with appetite, increasing appetite or weight gain in cancer. Okay, but keep in mind, there's only a few randomized control trials there. For all the reasons I mentioned, why it's so difficult to study these products. And then cannabis for nausea and vomiting associated with chemotherapy. There's actually a lot of, this is where probably we have the most evidence. There's been a lot of randomized control trials with, again, these pharmaceutical products with mixed results, but they're mostly better than placebo. And they're equivalent to other medications for nausea and vomiting, but they might have more side effects, unfortunately. Okay, how about glaucoma? Because that's definitely one of the first approved uses for medical marijuana, right? People say, oh, it's for my glaucoma. So there have been some randomized control trials for that as well, for oral or inhaled THC products. So these are more with the plant products themselves, that show a 10 to 30% reduction in intraocular pressure, which is what we measure for glaucoma. And the onset is fast, it's quick, it's within 15 minutes. However, it only lasts 3 to 4 hours. And unfortunately, folks tend to build up a tolerance to it, so it eventually stops working. So if you're taking your eye drops for glaucoma, I would say keep taking your eye drops, and I would not use cannabis exclusively for glaucoma. Stick with your traditional Western medications for that. And Parkinson's disease. So there's been some randomized control trials there as well, with more of the pharmaceutical products. And it's been shown to reduce kind of that unregulated muscle movements, but it has high rates of some low-grade side effects in about a quarter to half of the patients in the study. But the side effects weren't bad enough for folks to discontinue the use of the products themselves. Okay. And then an area that we're starting to look at where cannabis might be effective is in conditions such as dementia, not to reverse the effects of dementia, but sometimes when folks have advanced dementia, some of the behaviors that come along with that are things like agitation. And so cannabis is currently being studied to see, does it reduce the amount of agitation in folks? Okay. And then cannabis and health risks. So does it cause cancer? That was one of the big questions. And it does not look like it causes any additional risk for head or neck or lung cancer. And then does it cause an increase in the risk of heart attack? It might if you're using it and maybe you've never used it and you're using like a higher dose than your body is used to. So just be aware of that. Lung-wise, if you do smoke it a lot, then it might carry similar risks to smoking as far as developing emphysema or asthma and fungal infections, like I mentioned previously. Cannabis products can cause dry mouth, and so it can worsen or cause more periodontal disease. And then there's this relatively new syndrome that we recognize in medicine, I want to say about 5 or so years ago. It became pretty important, but cannabis hyperemesis syndrome. So if you use cannabis products at least once a week or more, it can increase your risk of this syndrome, which is just a really large amount of nausea and vomiting that make people very, very miserable, and is oddly enough relieved by hot showers, and then of course stopping the cannabis products altogether. Okay, so some friendly advice. I really would encourage folks to talk to your doctor if you're interested in trying cannabis, especially if you're interested in trying or using things that are not topical. So anything inhaled, anything that you would take by mouth. I would definitely recommend just talking to your doctor about that, because you might be on a medication that it could interact with. And then especially if you have other health conditions, and again, if you're on medications, don't be afraid of talking to your doctor about your interest in this, because it is not your doctor's job to judge you. Our job is to optimize your health. If you get a sense from your doctor that maybe they are not comfortable talking about this, or you get an unsatisfactory response from your doctor, consider asking to speak to a pharmacist, your clinic's pharmacist, or another physician who might feel more comfortable counseling you on cannabis use. It's always okay to ask to speak to another clinician or another provider. And then if you are going to visit a dispensary, I really recommend visiting one that's been endorsed by the Washington State Department of Health. They just have to receive a little more scrutiny and a little bit, go through a little bit more paperwork and meet certain requirements to be endorsed by the Washington State Department of Health. It doesn't mean that these products have all been evaluated and deemed safe. It just means that, again, this dispensary might have had to do a little bit more regulatory work to exist. Do not buy specifically THC containing products from the internet. Probably CBD products are okay, but specifically THC containing products from the internet, on the street, or synthetic products from gas station stores can actually be very dangerous. And then same approach as you would with medication, start low, go slow. The bud tenders are not geriatricians. And so if you're an older adult trying out some of these products, I would start at like a quarter to half of the recommended dose and then go from there and increase as tolerated. And then again, there's been a lot of research done on cannabis, and some of it is promising, like the seizures in children, that it really helps pain, nausea, and vomiting, but most studies have not included older adults, and older adults have different pharmacokinetics. Our bodies change, right? Topical or transdermal products are probably safer than oral products if you're going to try something. And then products with a higher concentration of CBD, higher than the THC, so higher CBD to THC concentrations, or CBD alone products are also likely a little safer. Okay. Try any new products on a day that you're not planning to drive or go out or make important life decisions. And sometimes it's great to have just like somebody else there or nearby, just in case you do experience one of these adverse effects and need to have someone there to get help or just watch over you, particularly if you're going to take it by mouth. And then again, just keeping in mind that these products are not tested, regulated, or quality controlled. Some of the products, though, have undergone additional testing. So you can actually ask the bud tenders which ones have these special certificates that have undergone additional testing by independent labs just for quality assurance and quality control. Not all products have that, but the bud tenders would know which products do. Okay, and then these products are really expensive. One of my colleagues told me that we've somehow managed to gentrify weed. So just bear in mind that these products can be very expensive, and only cash is accepted at most dispensaries. Again, this has to do with the Schedule I designation of cannabis products. So most dispensaries will have an ATM inside, but this makes folks who are going to dispensaries sometimes targets. So try to go with a friend or in a group during the day. And don't carry large amounts of cash on you if possible. And then just to remember that this is not a product that's legal in all states, like I showed you in the map, and it's definitely not legal in most other countries. So if you find a product that works for you and you're thinking of traveling, just remember that. And then don't forget that, again, like I said, it remains a controlled substance in a lot of places, majority of places. And if you work, you're still working, please just review your job's policy on drug testing and the use of cannabis. And then most importantly, lock it up, right? So states that have legalized cannabis products, like Colorado, for example, one of the things that they saw during the first year that it was legalized were a lot more pediatric emergency department visits from kids getting into their grandparents' stash or their parents' stash, because a lot of the edible products look like candy. So if you have grandchildren who visit or live with you, or young kids, please just make sure you keep it locked up and keep it secure. And it's a business, right? So if these were the magic beans, trust me, I would be taking them, I would be prescribing them, I would be promoting them, but clearly more research is needed. Think of it as a supplement, similarly unregulated, unknown effects, and you don't always know what might be in it. And here's a picture of me visiting a dispensary. This is one of the bud tenders. Again, it very much is a business, because I asked if I could take a picture of their product display, and he was like, no, because other dispensaries might steal the ideas that we have behind our display, and we don't want that. So it's very much a competitive business. So thank you. And this is Willie Nelson, who is a big proponent of using cannabis. He's 88 this year. And any questions that I can answer?
Nothing in the chat yet. Nobody has any questions? You gave a lot of wonderful information, so no questions. Yeah, okay, well, if we don't have any more questions, I want to thank you, Dr. Hirano. Thank you so much for a very informative and wonderful presentation. And we'll be emailing out everybody a evaluation form. Oh, somebody, Vicki has a question.
I just have a quick question. I used to work for an airline, and Delta Airlines, a flight attendant's college-age son came here, had to enjoy the legal state, and took you probably heard about this, doctor,
Oh, I think I did.
took some oral, got on the plane using his pass, free pass, so he's in first class, and he goes batshit crazy.
Oh no.
In the aircraft.
Oh no.
Trying to open the door to the plane while it was at 30,000 feet.
Oh,
Assaulting the flight attendant. Didn't you hear about this story?
I did not.
It was his first time
poor
using
guy.
oral. And I just wondered if you'd heard. If I think he's got charged with things, and he was by everyone who knew him, a really good straight A college student.
Oh,
And this
poor
happened.
guy. Yeah, I think so many young people think that these products are really harmless. But the amount of potency they're able to breed into these plants nowadays is really remarkable. And so, folks who may have dabbled in this in the 60s or 70s, like the amount of THC that they're able to kind of pack into the plant products now is really pretty staggering. And so even if there was a certain amount that your body might have been used to, even like 10 years ago, that might be very different today. And again, just, bearing in mind that some of the times to effect vary greatly from half an hour to 4 hours. So a lot of times people just ingest way more than they probably should, and then wind up in these in these situations where it can be rather scary, where you're feeling like your heart is racing. Some people feel like they're having a heart attack or they're dying, and it could be very scary.
So one of our participants said, thank you, very informative. And another one was the consideration for hepatic involvement in the excretion for cannabis was useful in providing information.
Oh, good. I'm glad. I know a lot of you are probably retired healthcare folks and professors, so I figured people might like that part. But
I'm just responding to somebody who asked if we could hear them. So I'm letting them know we can't hear them right now. I'm wondering with the young man that was on the aircraft, do you think that it could have been from like alcohol gets enhanced, they say, in the air? Could that have contributed to his situation?
They say he had just used the cannabis.
Oh,
Yeah, I think, the other thing to just be aware of is particularly in young folks, the other thing that you can sometimes see, and by young folks, I mean like in their teens, in their 20s, in their 30s, that's also the age around which like some folks can have psychotic breaks or severe mental illness can present around that time. And cannabis has been associated with possibly potentiating these psychotic breaks. So in folks who are already maybe prone or have schizophrenia or psychosis of some sort, the cannabis products can potentially worsen that or cause the actual, well, I shouldn't say cause the actual psychotic break, but it's been associated with that. And so that is the concern in the medical field, that just to be aware of.
Yeah.
Any other questions? I know I saw a couple of hands up, so please
here's
definitely.
one. Is its potential use in Parkinson and dementia can be quite useful and a better option than, I can't pronounce it. Question?
Sure. Yeah. So that's a really, really great question, because you're right that, we would love to avoid the use of quetiapine, which is an antipsychotic, because that itself comes with significant side effects that we worry about a lot. And so I think, again, it hasn't been studied head to head with other medications. So I can't comment on, it hasn't been studied against the quetiapine or even against things like Sinemet. And so it's hard to kind of say whether or not that's a good idea, but we are hoping to study its use in things like dementia, again, more for the agitation and not because we know that it does not reverse the memory loss or the cognitive changes in dementia. It's not a disease modifying drug, right? We still don't have very good disease modifying or any disease modifying drugs for dementia, unfortunately. But does it help with some of the agitation that we see? That's currently actually being studied, and people are writing grants to propose studying that as well.
Go ahead.
Oh, no, that was it.
Oh, okay. So we have two more questions. One is, do bud tenders recommend dose or frequency of use of CBD oil?
That's a great question. They will. You can usually find CBD only products. I mean, they're so available nowadays. So you can find CBD products in places like Bartell's or Rite Aid or Fred Meyer or QFC, or salons and spas. So CBD only products are very widely available. If you are interested in kind of getting more of a recommendation from bud tenders specifically, they're going to recommend probably more products with a combination of CBD and THC, even for the oils or topicals. So most of the products in the dispensary are going to have a combination product with like CBD plus THC, because CBD you can kind of get like almost anywhere. I mean, I think you can even get it added to your latte at some of the coffee stands in Seattle. So CBD is just so widely available that you can get that anywhere, and Rite Aid, QFC, Bartell's, like I said, anywhere with like pharmacy will have a stand with it, and I'm sure the pharmacist can kind of maybe direct you there. And then a lot of it is word of mouth too. So like at Harborview, I know one of the nurses found a CBD product that she thought was miraculous for her osteoarthritis or arthritis of her hip. And then she shared that with her colleagues, who other nurses at Harborview also thought it was wonderful. And again, the CBD is actually not something. So just to be aware too, the CBD does not show up in urine drug screens, right? It's the THC that gets tested for in urine drug screens. That's why nurses at Harborview are like, oh, CBD products I can rub on my sore spots. If at any point they're drug tested, that's not a substance that would show up in a drug screen. So that's, yeah, take that for what you will.
And then there's two more. This is the second one from before. Are there qualifications to be able to dispense cannabis legally?
Good question. So the bud tenders do have to go through a very minimal course, but really it's not, for example, the information I presented today, that's not something that they're expected to know. The course that they go through is like a 1 or 2 hour course, and it's really about safety. So about locking up the products and securing the products. And it's less about pharmacology or side effects or medical things. And so again, it's more regulatory, and anybody can take that course and get certified as a bud tender and get that certification as long as you're 18 and older. So yeah, unfortunately, there's, you at this point, you might know more than the average bud tender. But a lot of them like to do research. So again, a lot of the studies that they will quote to you are these Israeli studies, and they tend to be very biased. The bud tenders themselves, right? Like they wouldn't be working in a dispensary and selling it if they didn't think it was the magic beans. And so I'm not saying it might not be the magic beans for you, because like I said, the nurses at Harborview love, at least a couple of them really love this CBD topical lotion that they found. But it's about trying things, and it's about trying things safely, right?
Yeah. Couple more things. Got some nice comments and questions here. What about to own a store or to open a dispensary store? Do you have any qualifications?
Oh, yeah, you have to go through the state. Like there are definitely, you have to get the license and you have to go through the state. And the biggest barrier to starting up a business is the funding, right? And the capital, because it's a Schedule I substance. Like a lot of times you can't go through the banks. That's why they have ATMs. That's why you have to pay everything in cash. But as far as other medical regulations, I don't think there's a whole lot. It's more, again, very much this state regulations. Yeah, so again, cannabis just lives at this weird intersection of medicine and politics, and yeah.
And this question is sativa versus indicus.
Oh, good question. Yeah, I normally answer that in the talk. So sativa is thought to be more of the plant that the plant product or plant that brings on the high. Indicus is the hemp. Does that make sense? So one is hemp, the indicus, and the indicus, and the sativa is the plant that produces the THC and the CBD that has the psychoactive effects, whereas the indicus is the hemp product with no psychoactive effect. That's more purely hemp and CBD. So yeah, okay, which is the one that's legal. That's the one that President Trump made legal to grow in the US, whereas before it was completely illegal to grow any product. Except for way back in the history of the US, people used to actually grow a lot of hemp for rope products, but then it became illegal when it was classified as the Schedule I, and now it's legal again to grow hemp, or the indicus.
Nice. Okay, the potential use of some of the new strains for sleep would be an improvement over current market alternatives. And this is, of course, for HC providers.
Good. I think good comment. I think if people want to try it and they have better effects with less side effects than their pharmaceutical products, I think why not, right? It's what's going to work for you. I do think, again, if it's going to be an oral product or if it's going to be a product that you use regularly, and you're on other medications or you have other healthcare issues, it's still good to discuss with your physician or a pharmacist just to make sure that if necessary, they decrease the dose of medications you might be on that could interact with it, or just have a way to monitor the side effects or how you're doing on your other medications closely. And really, again, all of this is about harm reduction. Hopefully I gave a hopefully as non-biased a talk as possible. I don't have stock in anything. This is all about like, how do we reduce harm, but also allow people to feel like they can try products that might help them, but also safely.
Right, right. And then somebody wants to know, when will you do this talk again? And we are recording it, so we can send the link to the recording again, or if Dr. Hirano is going to be doing it again, we can let everybody know at that point too. Do you have any plans to do this? Anything scheduled to do this talk again?
No, I actually gave several versions of this talk, one at the UW with the pharmacy group, and then also at the American Geriatric Society annual meeting. And so, yeah, and then I was honored to be invited to give the talks to your communities. So,
we're
thank
so
you.
grateful for you to do that. It's so informative. You can see a lot of interest in it. We had a lot of participants today. So if anybody would like us to email you the link for this, please let us know. We'll be happy to do that. We might even include, I'm not sure if we're going to have it in time for when we send out the evaluation form, but if we do, we'll try to include it there too. So, well, Dr. Hirano, thank you so much. We really appreciate your time and all of the research that you've done. And thank you for sharing everything with us. So thank you, everybody. I'm Lisa Almo, Community Relations at the Lakeshore. If anybody's interested in more information about the Lakeshore or want to come for a tour, please give us a call. We'll be happy to help you in any way. So take care, everybody. Have a wonderful rest of your afternoon. Bye-bye.